With employers providing most of health insurance in the country, there are two groups that are predominantly left out: the poor and unemployed who don't have an employer, and the elderly who have stopped working. In 1960, 35% of the elderly were living in poverty, predominantly because of high health care costs without insurance. This became a major issue, and in 1957, Representative Foran of Rhode Island introduced the first Medicare bill. His idea was to tie Medicare and payment of coverage for the elderly to Social Security and pay for it through payroll taxes. Not much happened, although how to provide health care insurance to the poor and elderly was a major issue in the 1960 election between John F. Kennedy and Richard Nixon. But not much happened after Kennedy got elected. In the early 1960s, Congress passed a compromised, watered-down bill called Elder Care, which allowed the states to voluntarily get federal funds to provide health coverage for the poor and elderly. Few states did it, and it was widely viewed as a failure. In 1964, Lyndon Johnson swept into the White House with a huge landslide victory. He got more than 60% of the vote, and he began introducing major transformational legislation: the civil rights legislation, education legislation, immigration, and health care. Collectively, they became the Great Society program. Within 7 months of his coming into office, July 30th, 1965, he signed legislation for Medicare and Medicaid in Independence, Missouri, right near Harry Truman. Medicare was a program set up to provide coverage to the elderly, those people over 65. Medicaid was a state and federal combined program paid for largely by the federal government and administered by states to provide care to the poor and to disabled people. And that was the structure: employer-sponsored coverage for people of working age, Medicare for the elderly, Medicaid for the poor. That was the main bulk of how we paid for health care. But there were other government programs. There is Veterans Administration program to pay for health care for vets. There's TRICARE, which pays for health care for Defense Department and soldiers and their dependents. There's the Indian Health Service that pays for the health care of Native Americans. And there are other programs such as the Federal Employee Health Benefits Program that pays for federal workers. The result is a very complex system of how we pay for health care and the care delivered by various different people: doctors, hospitals, home health care agencies, and all the others, the drug companies, the device manufacturers, and others who provide the services and the goods in the system. We have a very complicated system. Next, we're going to look at how we actually pay for health care, how insurance companies, Medicare and Medicaid, actually pay doctors and hospitals to provide care.